everyone. Thank you so much for joining us. It's another episode of Masters of Health, and we are on with Shana Narula. She is the Public Programs Manager for Tobacco Endgame at Let's Shana
at the American Heart Association.
Thank you for joining us so
Of
much.
course.
Good evening. I just want to acknowledge the chat. Good evening. She view y'all. Greetings. Thank you for joining us. And everyone else will file in and we'll greet them as they come in. So Shana, tell us a little about yourself. This night is all about you.
Where should I start? So I am a public health professional, as you can see. I started my public health journey, I guess you could say academically in undergrad, but I'm going to tell you a little bit of a story that I always tell people, which is kind of funny, that I don't know if you know. So Deirdre and I have known each other for a few years, and we used to work with each other in New York City, but we're reuniting tonight live in front of all of you. I'm going to tell you this funny little story of when I was a kid. So I was in first grade. I think I was like 7 or something years old. And I created my own Just Say No club. This is how far back my tobacco control career goes, to first grade, where I was a self-appointed president because nobody else was interested. And I forced everybody in my neighborhood to come to my house for this Just Say No club meeting. And we had, I had to make all of them do an essay or read, a report basically on a different drug or tobacco or alcohol or whatever. And yes, and everyone got up on this little podium. I'm not kidding you. Everyone got up on this little podium and they read their little report about, LSD or alcohol or tobacco or whatever it was. And then afterwards, we all made T-shirts with puffy paint in my garage. So this is how far back it has gone, and probably due to the fact that my parents always kind of instilled this whole don't put bad things in your body into me at a very young age. And then when I was choosing the actual passion of mine in school, I was like, well, what's something that really speaks to me and something that would impact the most people? And I was like, tobacco. This is where I got to go. And my dad actually, he was like, why don't you do diabetes? Because at that time, when I was an undergrad, he was like, diabetes is so hot right now. And every single project I did in college was on obesity or diabetes or diet or something like that. But I was like, no, I'm going to go tobacco. So I started doing this even before I went to professional school. So that's where it all started.
That's a great story. You were serious. I don't know if I was ever that serious that young. I remember being in Dare. I don't know if people remember Dare, but I remember being in Dare.
Yeah.
I don't know if I remember what it stands for.
Something against
about drugs.
Drugs, I don't remember. Yeah. Something against something. But yes, we had that too, and then they discontinued it, which was a bad thing, I think.
Yeah.
No more funding, but
officer come and be like, if they had like the DARE officers, the actual police officer. Ours was. This is when I used to live in Florida. I lived in Orlando, Florida for a bit.
Oh wow. I should have been one of those DARE officers. That should have been my job.
Probably.
I guess that's what my modern version of that is now. So.
Yeah, maybe. So that was a great story. So tell us a little bit about your profession now.
So I have been doing tobacco control, I probably would say since my graduate studies. So I've been doing advocacy, policy, comms, all related to either tobacco control or non-communicable diseases. And when I say non-communicable diseases, it literally means, diseases you can't catch, right? That's the layman's term of how we say it, infectious is literally COVID, those types of things. And then NCDs or non-communicable diseases or chronic diseases are things that you can't catch, but they are due to risk factors or genetics and things like that. So that's kind of my background. Sorry?
I said like diabetes.
Yes, exactly, like diabetes. So that's kind of my background of what I've been doing for the last maybe almost 10 years-ish or so, or more than that. And, I've worked with various nonprofits over the years. I've also worked for city government, which is where I met Deirdre when I was working at the New York City Department of Health. And I've done local, national, and global level. So I've been in New York, I've been in Atlanta, I've been in Geneva, Switzerland, and now I'm actually fully remote, which is great on one side, and then on the other side, you never see people in real life. But it is what it is. So,
Yep.
but yes,
Yeah, I think.
that's
Go
kind of
ahead. Go
where
ahead.
I'm at right now. I actually just started my new role a month ago today. So today is my month anniversary at the American Heart Association. And it's going great so far. Yeah. So I'm excited to talk to you and to hear from other folks.
Okay, great. So I'm just going to pause for a second and go over to the chat. Greetings, everyone. Sister Kashia, top tier speakers, Sovereign Eats, everybody's welcome, welcome. Sham the Joy, peace, peace, peace. Thank you for joining us. So you kind of covered this in like your story and everything, but what area of health does your profession cover? Like, so to give you a little background, this series started out of a blog post that I did. Actually, no, it was a video first. Two videos. I did a video about like why should people, pick careers in public health? Like clearly, like we're in the pandemic and the outbreak, and it's like this is the field where you kind of get to learn about that and how to address them, like what it is and how to address it. Then I did like a follow up. What are the different careers you can pick in public health, right? And then, but using like the big brackets. So there's like health law, public health law, there's community health, there's social and behavioral sciences, there's mental health. So thinking about some of those, because like you're a fellow MPH, I know I don't have to like list them all. What area do you think, what area do you cover?
So in school, I actually focused on behavioral science and health education. But then the great thing about public health is that, yes, you can pick a track whenever you're in school, but that doesn't limit you because ultimately you're taking all the classes that everybody else takes, all the requirements are there, and then you just kind of focus in on a few more for your specific track. So I focus on behavioral science and health education, which did help me a little bit with tobacco because, of course, it's a behavioral issue. Um,
Yeah.
but when I finished school, I ended up doing policy and advocacy. So
Mm-hmm.
it doesn't really matter what you focus on in school. But I guess so. My background when I was doing my MPH was behavioral science and health education. But then because I was interested in tobacco control, it just kind of landed me in that way. And I ended up in policy and advocacy, and then comms too, right? Like
Yep.
when you talk about advocacy, you can't talk about advocacy without communications. So I think they're one and the same, and you cannot achieve any, advocacy or policy outcomes without effective communication. So I had to have experience with all of that kind of stuff.
Yeah.
And the unique thing about the MPH degree, when people say like, okay, you can get a medical degree or you can get a law degree and you can do this, this, and this. But for when you get an MPH, you can do whatever you want. I mean, you learn about you learn about epi, you learn about biostats, my absolute nemesis. You can learn about policy.
Same. I'm like, oh,
You,
numbers, run.
I got myself through. I made it on the other side, but it's
Me
not my
too.
favorite. That's why we have
Exactly.
statisticians and researchers to help
Mhm.
us along the way.
Yep.
You can do global health, you can do environmental health, you can do behavioral science and health. You can do anything you want, but if you
Yeah.
have an MPH, you can really, after you achieve that, you can really go on to do whatever you want. So it doesn't limit you. When I talk to younger folks and people who are interested in the field of public health, they're like, okay, what should I do? And I'm like, well, if you're interested in having like a great degree that gives you a good background, it won't limit you. It
Mm-hmm.
won't limit you to one specific, very niche thing. You have a lot of options. So I think that's really cool about this.
Yeah. So you mentioned like being able to go a lot of places in some of the job sites or cities that you've been in. So talk a little bit about that. Like I want to hear about the international one personally, but you can start off with whichever one you want. And folks in the chat, if there's one you want to hear about, I think she said Atlanta, Geneva, and there were some others. So
Yeah.
put them in the chat if there's one you want to hear about.
Sure. So I guess I started. So my undergrad was in DC. So I started in DC. And, that was when I was an intern in college, and of course, just getting my feet wet in the world of public health. And so being in the DC area was very cool because you're in the center of a lot of action. But at that time, I didn't really have a lot of impact. I was just an intern, I was sitting in a mailroom, literally. My first internship, we had 2 interns, and they put our laptops in the mailroom because there was some counter space. So you gotta start somewhere. And yeah, so then after that, I went to Atlanta to do my graduate studies, and over there I was working, or interning rather, at the American Cancer Society. That's when I really started doing tobacco control stuff, which kind of led me to my global experience. So I was doing my thesis, and I was able to work with the global health department while I was interning, and I wanted to do a global field experience, which basically was a summer of where you get to pick a place that you want to go and do your thesis research abroad. So I worked with some of the people that were mentoring me and helping me on my thesis committee. One of them happened to be South African, and it also happened to be the year of the World Cup, 2010. And so I had a few options of places that I could go, and I was like, World Cup and thesis, this sounds like a good idea. Yeah. So alongside my thesis research, I was able to win the lottery for one of the games, and I actually got to go to a World Cup game. So
What?
you can always blend your work with fun. That's how I live my life. And people ask me all the time, how'd you get to do this? I'm like, well, it was actually a research opportunity, but then I just happened to also be there in time for something like a world event. So that was really cool. Then I ended up in New York when I met you. New York City is its own country, I say. Even though it's within the United States, I think it is a very unique place. And over there, I got to be a part of, the whole policy process from start to finish, from the research phase all the way to the bill signing. I wish we could show a picture of both of us at the bill signing, but maybe.
Yeah, I didn't like bringing stuff like that.
That's a big deal.
Having a slideshow, like, yes, that's what bill signing looks like, and then you just hope you get a pen.
Yeah, and then you get a pen, and I gave one pen to my mom, and I kept one because I went to 2. One was for the baseball stuff, and one was for the rest of the package. And so I gave the first one to my mom, and then the second one I kept, and she still has that.
I don't know where they are. I don't know where they are.
You're doing. So for those who don't,
I think I only have 3, but we've moved. Like the office has moved, and I've shifted around. I don't have any now, so I don't know.
For those of you who are wondering what we're talking about with this pen, so when typically either the president or a mayor or some elected official, when they're signing legislation, the actual bill physically, they have a whole set of pens, and they sign each letter with a different pen, and then they give one to people who were involved in helping make that happen. And so Deidre and I both worked on tobacco control bills, and we both got pens. So
right,
it's like a trophy.
Right. Yeah, it's like a trophy. Yeah.
So that was in New York, I guess no, I'm skipping a whole thing. Wow. No, after that, working in New York, but at the UN level. So I was responsible for basically integrating tobacco control into UN Sustainable Development Goals. So I was working directly at the UN level with ambassadors and representatives and all that kind of stuff. And so, one of the coolest things I think about that whole process was attending the UN General Assembly for a few years in a row. So UNGA actually happens around this time, typically in person at the headquarters of the UN in New York City. It's when there's all heads of state and member states and all these people come to New York for this big, who's who event for a week. And typically there's some sort of health focus, and, got to be part of that a few times, which was cool. I also traveled to a couple of different, COPs. COPs is a Conference of the Parties for the Framework Convention on Tobacco Control, which is the WHO Treaty for Tobacco Control. And the first one that I went to was actually in Moscow, which was a little bit it was definitely a very, very interesting experience. I had to go through all those hurdles of getting a visa and all that stuff. And at that time, there was a crisis going on, with all the security and all that. So it was very interesting to get there, but it was a wonderful experience to kind of see how that whole process went down. What else? That was my time at ASH. And then New York City, got to speak at a few different conferences around the country on tobacco control. Then I went to Geneva, Switzerland, for my role with the World Heart Federation. And a lot of that was dealing with WHO, the World Health Organization, and, attending the World Health Assembly and WHO meetings and all that kind of stuff. So a lot of Geneva schmoozing with folks that are based there. A lot of the global NGOs have their headquarters in Geneva. And so that was a great experience to kind of see that firsthand. Yeah, and then now I'm sitting at home every day.
Like the rest of us. So I'm going to backtrack a little bit because what health people tend to, I'm going to say health because even clinicians, we tend to speak in acronyms. So
Right.
the first one, UNGA, is the United Nations General Assembly.
Yes.
Then the next one was NGO, that's non-governmental organization. And then you said WHO, that's World Health Organization. And then you said another one, COPS, but I can't remember. I don't think.
Conference of the Party. So it's basically a meeting of member states, so like different countries who are parties of this treaty. It's an international treaty. It's very complicated to say the words, but it's under the auspices of the WHO. So the UN has multiple different treaties, right? And the FCTC, the Framework Convention on Tobacco Control, was the only public health treaty up until recently. I think they may have added a few, but so the FCTC, WHO's FCTC, is basically the tobacco treaty, Global Tobacco Control Treaty. And so they meet every 2 years in a different place, usually in a country where they are a party and they have ratified the treaty. Unfortunately, the United States has signed it, but they've not ratified. That's a whole different it's a whole different can of worms that we won't open right now. But yeah, so they have meetings every 2 years where so NGOs, so non-governmental organizations who are able to be observers of it, they participate, as well as member states. So people who work in health departments, people who work at the national level, etc. They all come to discuss the treaty every 2 years. So that's kind of the easy way to explain that. So that's taken me, a little bit of. I've been to 2 of those now. One was in Geneva, which is always kind of boring when it's in Geneva because you're already there. And then the other one was Moscow, which was the more interesting one. So yeah.
So how was Moscow? Because we kind of went through how did you become like your career path, which is awesome because it also opens up the door for people who are kind of curious about public health, moving into that space. All of the things that you can do, you can travel. I mean, it might be a little tricky now because of what's happening, but you set yourself up to at least interact and engage with people from all over. So tell us a little bit, since Moscow was really interesting, tell us a little bit about Moscow.
I would say we didn't really leave the convention center much, to be honest. Like, first of all, it was in October, so it was cold. And second of all, just as normal like security type thing, we're Americans, not exactly the best place to be if you're American. And then I'm also brown, so then put that on top of it. So we did like one day of sightseeing where we saw the Kremlin and we walked around a bit. But besides that, we were pretty much kind of convention center and then back. But it was very interesting to kind of see how the people operate there. They're very serious, from what I could understand from my very short time experiencing it. Their subways are very interesting, though. Their subway stations look like museums. They have like art installation, and every single one has a different theme. I know New York is trying to do that with tile work and stuff, but not really.
I was just gonna say, why does everyone else's subway system look so much better?
Yeah.
And you know what? All the flooding lately, like, I don't even know.
Let's not talk about flooding. We had flooding. It was awful.
I caught a video where someone caught like a rat just having fun, like just twirling around in water. I was just like, yeah, they don't care.
No, the rats own the subway.
You do. Yeah,
Yeah.
we actually move out of their way if they're coming down the platform.
I think at certain times, I think they may be bigger than me. So.
Yeah, I had someone I knew before. She called them cats. She's like, no,
Oh
the
yeah,
cats are the cats are.
for sure, definitely. Don't underestimate the New York City rats.
Yeah, yeah, they're like people. And
Yeah, I think kind of to go back to that whole concept of like, you can travel and you can meet new people and you can meet different types of people, especially when I was doing my global health work, global tobacco control. I think the coolest part of it was I was part of this team where people were located in every continent, almost except Antarctica, located everywhere, and you got to interact with them on a regular basis, and you got to have friends everywhere. I became close with one of our advocates who was a physician in Peru. I took him around New York City. We watched soccer matches together, World Cup again. I don't know, some theme, I guess. I became close with people in Japan, in Latin America, in Europe, all over the place, and they become your friends, and you see them at UNGA every year, and you give them huge hugs, and it's like such a great reunion. It's like you become part of this community, even though you live so far apart from each other. When you do get to see each other again at these meetings and things like that and conferences, it's such a good feeling because you know that you're part of the same team, and you get to know each other after a while, and you get to know each other's family and that kind of stuff. I had somebody who he unfortunately passed away now due to cancer, and he was a physician, and he was also an NCD champion at the UN. He was the representative and permanent representative for Palau, which is a Pacific Island nation. He became a really good friend of mine and a champion for us at the UN level. And he said, whenever you're in Palau, the offer always stands. Please come to my home and have dinner with my family. And that's the kind of thing that, people do when you get to this kind of camaraderie and you become part of this public health community. Everybody becomes part of your family, which is really great.
Oh, that's awesome. So fast forwarding to now, well, it's pretty new. So you can pick any one of your different experiences. Tell us about a day in the life of.
Okay, so the thing is that now it's very different because we're in a COVID world and we're in front of the screen 24/7. So it's not as exciting as it usually was, and it's not as exciting as it potentially could be in the future. But I'm hoping and I'm praying that in the future we'll get back to that. If people just, stay on track and be safe and, do the things. And this is a public health, stream. So I'm going to say, get vaccinated. Yeah.
I think people should have a choice, because we're learning that a lot of people feel like they're backed into a corner. So it's like, if it's for you, then it's for you. And if not, then do what you need to do to keep yourself safe, and also think about how to keep others safe. Wear your mask, social distance, wash your hands. Don't be nasty.
Don't be nasty. That should be on a t-shirt. Don't be nasty.
Right. You heard it here first. Don't be nasty.
So nowadays, I guess, it's basically like meetings every day. I mean, it's also different based on which organization it is, right? So previously, I was part of an organization that had a very small team, maybe 6, 7 people. So I was basically in charge of my stuff, and we're very close with each other, versus now where we have 300 staff across the country. And so it's very different. Similar when I was in city government, right? You have your little pod that you work with every day, but city government is massive as well, 4,000 or so people. So I guess it just depends on the organization that I was working for at the time. Today, it's mostly lots of meetings and meeting new people and making sure they know what I'm doing, and me getting to know what they're doing, so that you have the knowledge of who to reach out to when you need them. But for the most part, it's getting to understand our grant. So I'm actually managing a grant right now, working with people on the ground in different areas of the country. So we have grassroots directors and government relations directors across the country. They kind of cover different regions. So like the Northeast, the Southeast, the Midwest, the Western states, I hope I'm not, and the Southeast. I think or maybe that's one.
So
No, I haven't memorized it yet, but so we have these staff who are on the ground in these areas, and they can come to me if they have questions, and then I can go to them and say, okay, please disseminate this as needed in your community. So it's a cool way to kind of, you're reaching these communities like at the local level, but you're doing it through these folks who have relationships on the ground, with community organizations who are well established. And that's a big thing. Of course, you're very familiar with this. Having, community organizations who have clout and who have rapport with the community itself is very, very impactful and helpful when you're trying to pass legislation, when you're trying to educate your community, when you're trying to do all that kind of stuff. So it's important to have somebody on the ground who already has those relationships established so that you can, achieve your goals. And so that's kind of how AHA works. Like, you have the National Center, which is where I sit, and people can be based anywhere. They're actually headquartered in Dallas, but they have staff all around. And the good thing about my position, COVID or not, it was remote anyway, so I can live anywhere. And yes, you can be mobile, you can go wherever you want, but then certain roles, of course, have to be based in those areas to deal with those people. But so it's a cool way to kind of connect with other folks and have your reach span that far. Because I mean, if you think about it, the United States is very, very, very large.
Yes, that's why you have to split it up into regions, like Hungary.
For sure.
Who we're gonna send is tribute. So, one of the questions that I like to ask is, and this might be hard, because like you're very like, this is what it is and this is what I love. And I've had people on here who like, well, this may have been a problem for me. So the question is, what is one pro and one thing that you wish you could change?
One pro is definitely knowing that the work that I do saves millions of lives. It's a fact. I mean, I know that, the policies that we passed in New York City, the global UN level stuff that I've worked on, that's implemented at country level around the world, knowing that I have had a hand in that and, took part in that and was responsible for that, it makes me feel amazing that I have this global reach and that, we have done something for the good of humanity. That's what I definitely would say is a pro. Something that I could change. I always say this in policy and advocacy, you have to be very patient. That is one of my downfalls in life, is that I'm not a very patient person, but after working in city government, you kind of have to be.
When they're done with you, you'll learn.
Yeah. So being patient so that, you can achieve your goals is something that I really had to learn. If I could change things, I would love to pass, a bill every month, but that's not going to happen. It takes time. It takes time to do work in the community. It takes time to work with council. It takes time to work with the mayor's office, within the city government, all that kind of stuff. And then ultimately it ends up being 2 years later and then you pass your bills.
I don't know, that's what's been happening with menthol, but this is a little different because then COVID happened. So we'll see what happens with that.
Yeah.
The final question is, what advice do you have for any aspiring public health students that are interested in advocacy and policy, or even specifically tobacco control?
I would say that if you have a passion for it, then go for it. If you're, on the fence about it, I would try to find something else, because ultimately you got to be very dedicated when it comes to tobacco control. You're not only up against, you're up against a lot. You're up against the tobacco industry. You're up against policymakers who may or may not see eye to eye with you. You're up against other competing priority issues within public health, because, of course, there are so many different things. Look at right now, there's COVID, there's tobacco, there's diabetes, there's, sugary drinks, there's everything. You're always going to have competition, because ultimately there's always going to be health problems. That's just the way it is. And so I would say that if you're interested in this kind of work, you got to be very dedicated and you got to be patient. if you're talking about advocacy in general, I think that it's a really cool way to affect change. I mean, it really does impact the lives of so many. When you walk around New York City now and you see the bills that we had a hand in passing in effect, it's such a good feeling. You're like, wow, I was part of that. You know, it's like you had a part in changing the lives of so many people. So I mean, I think advocacy and policy is really a really cool thing because, you know, people may be interested in research or they may be interested in communications and all that kind of stuff, which all combines together to get you there. But if you want to see some sort of impact, I think policy and advocacy is a really, really cool way to do that. Because ultimately, then you have like an end result. Something passed, something happened, as opposed to if you're gonna go into research or something like that, you can keep publishing and you keep publishing, but until somebody takes that data and that information from when you publish and does something with it, it's just gonna sit in a journal and maybe your mom will read it. You know, like maybe a few others, but I don't even know. I don't even know if my mom read my whole thesis. I mean, she looked at it. I don't know how. It's very long though, so whatever.
Yeah. Know that my parents read things. They'll look, you know, it'd be like the pictures. Look, you know, she's in this magazine. I don't think there's any reading on the article. Like it's the picture, magazine. There's dates.
Yeah. I think another cool part of advocacy is that, you know, if you're a people person, if you're interested in like public speaking, if you're interested in, you know, interacting with people in the community, it brings you it brings so many skills to that. I mean, you have to have so many skills to do it, but if you are that type of person, you have that type of personality. I mean, there's nothing wrong with research. If you want to be a researcher and you're more like into being in the lab or being behind the scenes, then that's great. We need researchers. If we don't have research, we can't do anything. I'm just kidding, obviously.
This is true. It's true. I think what you're saying is right. Because when I started out in my career, I was doing research in cancer, and it was like we wouldn't have anything if we didn't have research, and so it is crucial to have those people who prefer to be in the lab and collect data, or even do field data, or you know, be ones to like kind of review things from the past and like kind of find a line and things that correlate, and then say, hey, look what I found, this is what it is. Because you're right, that's exactly when we say evidence-based, that's what we're talking about.
Yeah, I mean, everything we do has to be science-based and fact-based. So I was kidding, obviously, but my personality clearly is not of a researcher. I mean, I did it for school, but that's not what I would love to be doing for my life.
I like it when I like it. I like it.
I like it when it serves the purpose and I can write strong statements about stuff. But yeah, so I would say that if you're a person who has like a more extroverted personality, that kind of thing, you like meeting folks, you like making connections, you like traveling and going different places and presenting and all that kind of stuff, then I would say advocacy is a really great option. And you get to work with so many different cool people. So, and specifically in tobacco control, if you're interested in tobacco control, you have to have a thick skin, number one. Number two, you have to be die hard. You got to be ride or die, because there's always going to be something that you're going to be going up against. And you need to be able to go up against it. So that's what I would say. But the people who are in it, some people say that they've fallen into it and then then they become part of the community. Yeah. So many people that I know just say, oh, it just kind of happened. And then they get really entrenched in it. And then there's people like me who knew in first grade, you know?
That was a great story. Like, yeah, I had them speak on podiums and we were practicing because we were going to be up in front of city council talking about why this is a miss.
I was going to be on the floor of the UN talking about this. Little did I know, right?
Right. You're like, I'm manifesting this right now. First grade. How old are we in first grade?
Three? No, like 6 or 7. 7 maybe, something like that. Yeah. Okay. My dad told that story at my wedding too, which just happened. So it's
All
It's a
right,
good
congratulations. That's right. That's right.
yeah.
That's a story to tell the graduation. I mean, I guess it's interesting because your voice hasn't even changed yet. You're like, yeah, I'm like, I wonder what those podium speeches sounded like.
People
If
were
they
just
like,
reading. That was back in the day when you only had like one disc of an encyclopedia, or like you had to go read it, look it up in a book. No internet.
yes, yeah.
Or it may or may not have just been the whole page on LSD on a page, and then they just read it. But you don't know. At least we made them do it.
Did we even know what LSD was?
They had to learn about it. They had to learn.
Yeah. Okay. Well, maybe you changed some lives. Maybe they, I don't know if you still know any of them, but maybe they had some interesting career paths
I
based on
do,
what
but
you.
most of them are doctors, to be honest.
Oh, really?
Yep.
That is hilarious. That is hilarious. Well, they have a story that could correspond with yours.
Yes, for sure. For sure.
Okay. All right. So thank you so much. That's the end of the questions that I have. There's not necessarily any questions in the chat, but we had a lot of people watching today. And of course, there'll be more after. So if you are catching this live after the fact, make sure that you like, share, and subscribe. I think it's over. It's on your side, Shana. So it's like down at the bottom. Like, share, and subscribe so that you'll know whenever we come live with a video. When we're scheduling things, and also feel free to put any questions in the comments. Shana, do you mind if I put your LinkedIn? So if anybody has questions about tobacco control or would like to ask you a little bit more career, I'll put your LinkedIn information in the description box below.
Sure, no
And you can
problem.
also learn more about Shana in the description box. So as always, thank you for coming, everybody. Thank you to our guests. If you have any, ideas and things that you want to talk about, you can contact us at any of the social media handles below. You can contact me, deidresully@gmail.com. Put a message in the chat, DM me, whatever, however you can get there. Peace, everyone. Thank you. Have a good
Thank
evening.
you. Have a good evening.